Hello, everyone. Good morning, everyone. Thank you for being with us today. Today, we are going to be speaking about one of the many other epidemics, pandemics that are going on hand in hand with the COVID-19 pandemic and actually have been exacerbated by the pandemic. It is so very important not to forget these other crises that we faced prior to the pandemic and have only gotten worse. The commitment that we have made as a party is to make sure that no one falls between the cracks, that no one is forgotten, and that no lives are lost unnecessarily because of inaction by the federal government. One of the areas that needs and has needed urgent action for some time and has gotten much worse during this pandemic is our opioid epidemic. We are very clearly calling for the decriminalization of possession of opioids and other illicit drugs, and for the creation of a safe supply. We have been, and also, of course, hand in hand with that, the creation of additional community and social supports in order to assist users. This is something that the Green Party has been calling for consistently for years. It is something that is more urgently needed than ever. And we are calling for it again today in order to save lives immediately. I'm really pleased to have with us today Guy Felicella, who is a peer clinical advisor for the BC Centre on Substance Use, and also our MP for Nanaimo Ladysmith, Paul Manley. To put this in some quick context before passing it over to them, it is very important for us to know and to realize that we have now just closed the record-breaking year for opioid deaths in Canada. We're headed towards record numbers again this year. We know that in provinces like BC and Ontario, they have already reported record numbers. We know that factors that have been exacerbated by the pandemic, like border closings, disrupted drug supply chains, an increasingly toxic supply, reduced social services, closure of safe injection sites, all of these things have contributed to deaths around the country. And so for our part, we fail to understand why the federal government continues to hesitate in decriminalizing possession, and why it has failed to work to create a safe supply nationwide. You cannot, on the one hand, acknowledge that this is a health crisis and not a criminal crisis and continue to lock up people for a health emergency. We support the calls from the BC government and also from various municipalities across the country for an exemption under the existing Controlled Drug and Substances Act, but it's a call that they should not have had to make. It's something that should be done under the leadership and the initiative of the federal government, and it's something that we want to see done within the life of this parliament, and no later than Canada Day 2021, because we've had enough reports, we've had enough studies, lives are being lost daily, and it's time for that to stop. Alors en français, je suis très contente d'accueillir aujourd'hui, je suis très contente d'accueillir aujourd'hui Guy Felicella, qui est un aviseur, un conseiller dans le BC Centre on Substance Abuse, et Paul Manley, notre député de Nanaimo Ladysmith. Nous sommes ici aujourd'hui pour dire que nous voulons presser le gouvernement fédéral de décriminaliser rapidement la possession d'opioïdes et d'autres drogues illicites et de créer un programme national d'approvisionnement sécuritaire. L'année 2020 était une année record pour les morts causées en conséquence des détoxifications d'opioïdes. On sait que la fermeture des frontières, la perturbation des chaînes d'approvisionnement en médicaments, et la réduction des services sociaux et la fermeture des sites d'injection ont entraîné une record de décès dus aux opioïdes dans notre pays. Nous ne comprenons pas pourquoi le gouvernement hésite de décriminaliser les drogues et d'assurer un accès sûr aux drogues sûres, surtout parce qu'on sait que ça provoque des morts. Les processus criminels ne sont pas une bonne réponse à une crise qui est une crise de santé et pas une crise criminelle. Alors, nous soutenons tous les appels, toutes les requêtes des provinces, de provinces de Colombie-Britannique et aussi de nos municipalités qui cherchent la décriminalisation des drogues dans leur territoire. Mais on dit que c'est la responsabilité du gouvernement fédéral de le faire. Et on leur presse, on leur demande de le faire avant le fin de cette session de Parlement et avant que nous fêtons la prochaine fête du Canada cette année. Parce que c'est une crise, il y a les gens qui meurent chaque jour, c'est prévisible, c'est évitable et il faut agir dès maintenant pour décriminaliser, créer un accès sûr et aussi créer les soutiens pour les communautés pour assurer que les morts arrêtent et qu'il y a les soutiens nécessaires pour les personnes qui utilisent les drogues. Et avec ça, je passe à Guy. Guy, I'm just going to pass it to you for your comments. Thanks, Guy.
Thanks, Annamie. Hi, everybody. Thanks, everybody, for attending and listening. This is obviously something that's near and dear to my heart. For many years, I struggled with substance use and felt the full impacts of what it's like to be criminalized and punished and offered only incarceration instead of other alternatives to alleviate the struggles that I was having in my life. This overdose crisis is devastating Canadians across the country, communities. More than 20,000 people have died since 2016. And also, too, you have to remember, many years before, there's been so many lives lost due to the contaminated drug supply, but also other substances as well. And 2020 was an unforgiving year for not only every substance user, but also their families, their friends. And what we've created is a trauma crisis by those impacted by this overdose. The loss of life is weighing on families, communities, friends, and people who work in the front lines trying to triage this devastating emergency. The crisis is not getting better, it's getting worse. And each day it gets worse. And with an unpredictable drug market, we cannot predict anything. The sad lack of infrastructure that we have is killing people every day. The tragedy is that each of these deaths are preventable. And the deaths are being fueled by the illicit drug supply. And the only way that we're going to end this crisis is through a regulated alternative to the illicit drug supply that we have allowed to be controlled by organized crime. The federal government can take steps, and immediate steps, to support the policies that will help separate people from the illicit drug market. We don't need to partially remove people from it. We need to completely remove people from it. And the prescription-based approach that's in place today, which relies on doctors to prescribe pharmaceutical alternatives, is necessary, but it's also limited. There aren't nearly enough prescribers willing to prescribe to meet the demand and need across the country. The demand for a regulated supply cannot be met by the medical system alone. There needs to be more pathways. There needs to be a pathway outside of the medical system. The federal government can grant exemptions under the Controlled Drugs and Substances Act that would allow for a non-medical pathway to a safer regulated supply. Or another approach would be to change the CDSA, and so the prescription model, we could alleviate the prescription model. A regulated supply is what's needed as an emergency response today. All levels of government must act. If we don't act, each loss, each day, and each additional death is a result of a policy failure. And I know for myself that being criminalized and punished for struggling with an undiagnosed ADHD and mild comprehension disorder and self-medicating it from it for decades and being punished for it, we're adding layer after layer after layer of trauma onto people that are struggling already. And also too, we have to consider is that not everybody who uses substances has a substance use disorder or an addiction issue, but everybody who uses these drugs is at risk of an overdose or an overdose death. And what we've really gotten good at in our country is bringing people back to life. That's not addressing the problem, which is the illicit drug supply. We need to have a safer, regulated supply that people can have access to it, and one that would meet substance users where they're at and not the system where it's at. In order to save lives, it's going to take bold actions from all of us. We need to be better. We can be better. Thanks for listening.
Thank you so much, Guy, and thank you so much for that call to action. You're absolutely right. And I'm going to pass it to Paul now. I was telling Paul just before we came on that we're in different parts of the country. I'm in Ontario, Paul is in BC, and yet our communities are facing the same struggles. Here in Toronto Centre, we have a profound loss of life. We have actually a record-breaking loss of life this year from opioid poisonings. We don't even say overdoses, opioid poisonings. And during my last campaign, we had Naxalone there in our office, and we were all trained in how to use it, exactly because it was something that has to be used very often in our community. Paul, over to you, please, for your comments.
Well, thank you, Annamie. The Green Party has been calling for decriminalization and an end to the war on drugs for a long, long time. And it hasn't been a popular thing to talk about in previous elections, but it is what needs to happen in this country. And we should be looking at models of what other countries are doing and creating a made in Canada solution to the war on drugs. It needs to end. In British Columbia, we've had a health emergency that was declared in 2016. Thousands of people have died in British Columbia, 1,700 in 2020 alone. And these people are not statistics. One of these people in 2018 was my cousin, who I was very close to, who had schizophrenia, who is in and out of the criminal justice system when he should never have been part of the criminal justice system. And he died of an opioid poisoning. We cannot control the flow of things like fentanyl coming into our ports, but we must provide a safe supply. We need to deal with this as the health crisis that it is. We have had right in front of my office, my own staff have had to administer naloxone to somebody having an overdose crisis right outside of our office. This is affecting all of our communities in so many ways, and we need to deal with it in a rational way. And the federal government needs to step up now. They need to decriminalize, and they need to provide a safe supply of drugs so that we end this crisis, this health crisis here in British Columbia and across this country. It is time for a rational approach. Law enforcement has been asking for this for a long time. The Canadian Association of Police Chiefs have asked for this. It is time for the government to step up, decriminalize, provide a safe supply, and work on this as a health crisis. Thanks, Annamie.
Thank you, Paul. Thank you, Guy. And that is essentially it. The Green Party has been making this call for many years now. Paul, you're absolutely right. I did not hear a lot of support in the 2019 election when I was out, excuse me, stumping for a safe supply and decriminalization. But this is absolutely something that is long overdue. There is nothing left to do but to do what is right, to end the stigma, to decriminalize, and to ensure that there is a safe supply as an alternative to the toxic supply that is poisoning and killing people across Canada daily. And so we deliberately put a time limit on this. We want to see not a promise, but action within the life of this parliament, and no later, excuse me, than Canada Day, because we have all the tools that we need to take action, and there is no excuse not to take action. Alors, nous avons tous les outils nécessaires pour prendre action. Chaque jour, sans action, il y a des morts. Il y a des morts partout au Canada, des morts évitables. Alors, nous avons dit clairement au gouvernement que l'expectation est que nous aurons une décriminalisation des drogues et aussi la création d'un accès sûr pour éviter les morts pendant la vie de cette session de Parlement et avant qu'on fête la prochaine fête du Canada. Parce que nous avons tout ce qu'il faut et l'inaction cause des morts. On veut terminer ça, on veut dire stop à ça. Et on soutient tous les appels partout au Canada par nos officiels de santé, par nos municipalités, par notre association des chefs de police pour la décriminalisation et pour un accès sain et sûr. Merci. Et avec ça, on prend des questions. With that, we're happy to take any questions.
Thank you. We'll go to questions now. One question, one follow-up. Une question et un suivi. David Thurton, I see you have your hand up. So we will go to David Thurton with CBC.
Hi, Madam Paul. Thank you so much for taking questions. I guess what I want to ask you is, would you be satisfied with a patchwork approach where the federal government allows certain communities and municipalities to decriminalize drugs? And would that prove effective if you had, one community where you could, possess drugs without consequences, and then if you are if you work in Alberta or you work in a different part of the country on a rotational basis, it's criminalized? Would that be helpful?
That would not be helpful. It is very unfortunate that communities like Vancouver, like Montreal, have had to go to the government requesting exemptions. It's very unfortunate that the province of BC, excuse me, has had to go to, excuse me, having a difficult morning, has had to go to the federal government requesting an exemption. This is an area where the federal government should be showing leadership. It should be a nationwide approach, and it should be simple. As Guy and Paul said, it should be immediate decriminalization of possession of illicit drugs. It should be the creation and easy access to a safe supply to replace the toxic supply that exists now. And it should be the ramp up of all of the community and social supports that are necessary to help users and to keep them safe. Things like mental health services, community supportive housing, affordable housing, a guaranteed livable income, all of the community supports that can help. So this is something that is not solved by a patchwork. This is not something that should take years and years of municipalities and provincial governments coming to the federal government, making this plea to save lives. It should be simply the leadership of the federal government, and it can happen within the life of this parliament. We are not looking for yet another promise to study, to investigate, to do pilot projects. We're looking for this to be treated like the health crisis that it is. And that means doing all of these things as soon as possible and across the country. Guy, I don't know if you have anything to add to that.
Yeah, and I think too, if you look at outside of the prescription model, what also needs to happen is there needs to be funding to do research on just how effective it is as well. So we would ask the federal government as well to step up on the research to support the science behind it, because the science is the evidence that we need. And if you look at other countries such as even Switzerland, who has a very successful safer supply program out there, it's proven that it's very successful, and it's been in existence since the 90s. And so hopefully us in Canada would have the same standards. And Switzerland is a country that has 8.5 million. Our country is 37.5 million, and there's really only 420 injectable IO programs across the country. That's one of the things that needs to be really looked at and changed, where it's about accessibility for people to have access to this, because if we don't have access, then we don't really have a safer supply. If people can't access it, then it's not safer. And the decriminalization piece, it does not stop the overdose crisis either. So if the federal government is going to decriminalize, then they would have to have a safe supply structure in place as well. So we need both.
Thank you, Guy.
So just the follow-up, I'll be quick here. I know you're mentioning things like a guaranteed livable income, access to housing, and some other things. But, I wonder if you could speak a bit more to that, because yes, it's all well and good to help people survive, but people want to thrive. And a lot of these people who are suffering from addictions would say that I want to get over my addiction. So I guess, what do you also need to see? Maybe Guy could speak to this, maybe Paul could speak to this. What are the tangible steps that you would need to see to tackle this addictions crisis that just go beyond decriminalizing?
Paul, do you want to take it first?
Yeah, we need affordable treatment beds in this country. We have a treatment center in Nanaimo, and it's completely unaffordable for any family that wants to help a loved one go through treatment. You're mortgaging your house, and that is not a sustainable model for dealing with addiction. Addiction is a social issue, and if you look at the studies, the Alexander studies about how social connection is key. A key part of why people end up in addiction cycles. One person can go to the hospital and get a prescription for opioids and be able to come off of them no problem. Another person will get a prescription and end up becoming addicted to them. It's a social issue. It's a health issue. There's a lot of different aspects to this that we need to work on. And key to that is when people ask for treatment, we have to be able to provide treatment. It needs to be affordable and needs to be accessible. So, those are key elements, I think. So I'll let Guy see if he has anything to add.
Yeah, Dave, and Dave, one of the main drivers behind a substance use disorder or an addiction is childhood trauma. And yet we are so focused on the substances, but we are actually not focused on the trauma that's been caused on the individual. So it's extremely hard for somebody to go through a 4-month treatment program and then to still not even scratch the surface on the traumas that got them there in the first place. What we also need too is we need trauma therapy covered under the MSP so that people can access trauma therapy. And in my own life, 15 years of being in and out of treatment, the last time I was in treatment was an outpatient program that had trauma therapy. And then I understood the traumas that I'd endured because there's just so much layers of pain. And the drugs were just my solution to those traumas. So we've got an addiction system or a treatment system that focuses on getting people off drugs. It doesn't specifically always focus on the traumas that are involved that cause people to use the drugs. And until we address all issues, we're going to have the revolving door. And the majority of people that try treatment, they use again. So we need a system in place, like anything where you walk into the hospital. If you have a heart condition, there's a specialist involved. There's a combination of things that happen immediately, and we need the same support, starting with obviously the toxic drug supply to address that, but also pathways to get people who want to be off illicit drugs into the treatment services that they need immediately.
And maybe just to add, David, just concretely in Toronto Centre where I ran, you had people that, we have safe injection sites, and that is definitely a key thing. It's important to have, but we have people using the safe injection sites. We ensure that they haven't overdosed, and then they have to leave. They have to walk back out onto the street. There are no back-end services at all, whether it's mental health services, whether it's ensuring they have somewhere to go and sleep, whether it's ensuring that they have somewhere to live. There is very little in way of other supports, and so it is a problem that requires a holistic solution. And without all of the elements in place, then you are not ultimately resolving it. So decriminalization, safe supply have to also go hand in hand with ensuring that we ramp up the supports that are currently missing. We need a national mental health strategy. We need a proper national housing strategy. We need a guaranteed livable income. These are all critical elements in terms of making sure that we are approaching the person as a full human being, and not simply, again, in terms of their addiction.
Thank you. Are there any other questions, please? Est-ce qu'il y a d'autres questions, s'il vous plaît? No? Well, this concludes the press conference. Thank you very much for attending.
Can I ask one more question? Sorry. Sorry, David here.
Sure, David, go for it.
Okay, thank you. Thank you for indulging me. I appreciate this. I have two questions that are politics related. Are you seeing any signals from your counterparts in the House that there might be movement on this? I see that their Minister Lametti is going to introduce a bill to amend the criminal code and controlled substances and drugs. We've heard comments from various conservatives that seem to suggest some sort of movement on their views on decriminalization. Have you seen any movement? Have there been any signals that you might get some support for this? There might be some support that this might be the time.
Well, this is, and you'll forgive us, Guy, for a little bit of partisan talk here, but Paul is absolutely right. This is something that the Green Party has been out in front of for many years now. And for the reasons that Guy said and that Paul has mentioned, this is a question of life and death. And so we were not afraid. We were unafraid of being the first and being the only ones within the context of the 2019 election to call not only for decriminalization of illicit drugs, but possession of illicit drugs, but also for a safe supply. And so we have heard parties and leaders of the other parties say some, but not all. Some support a safe supply with caveats, but they don't support decriminalization. Some support decriminalization, but they're not willing to go as far as saying they support a safe supply. As Guy said, and as the consensus amongst those who are on the front lines have said, the two things must go hand in hand. And so we would, of course, welcome, as we would in any health emergency, the cross-partisan support of the other parties in getting this done within the life of this parliament. If there is the will to do that, the government can absolutely count on our support if there's the will to do those two things. But it has to be those two things, and it has to be nationwide. We need a nationwide decriminalization of possession of illicit drugs, and we need a nationwide access to a safe supply in the way that Guy just described. And we also need to see the ramp up of our commitments to the community and social support programs and services that will also assist people who are drug users.
I would just add, David, that I've tabled a number of petitions related to decriminalization and the use of psychedelics for drug addiction. And the responses from health and justice seem to be, more open to moving forward. The public safety response is the law is the law is the law. But when you read those responses, you can see that there is some movement within the Liberal Party. Other parties are standing up in the House and talking about the overdose crisis, and all the parties are talking about this because it's affecting constituents and MPs across this country. So there is movement on this. Annamie is right, though. It's just talking about different approaches, and we have to take our regulation of drugs out of the hands of organized crime. That's who regulates drugs in this country right now, organized criminals. The government does not regulate the drug supply. And so the government needs to step up and take on this role and provide a safe supply and help people who have addiction issues and this work on the trauma. Like as Guy was saying, people, when they go through treatment, they need a follow-up plan, just like anybody who's gone in for heart surgery would have a follow-up plan when they leave the hospital. And you need those wraparound services to work with people to help them through. But there is a growing consensus, I think, in the House of Commons that we have a crisis and we need to deal with it. There are different approaches from different parties and from different MPs within those parties. But I think that it's time and it's long overdue for some changes to our criminal code and how we approach this.
Thank you, Mr. Manley. David has one follow-up. Do we have time for that, Annamie Paul?
Yep, I think we have time for one last one, and I always love speaking with David. So David, go ahead.
Oh, thank you. So this is for Mr. Manley, and maybe Madam Paul, you can chime in. But I was just intrigued that your party voted against the committee to examine Canada's relationship with the U.S. You had that little flippant comment, Mr. Manley, while you voted that Trump is gone. So I'm just wondering, aren't there important issues to examine, such as, I guess, a continental strategy to tackle the environment and climate change? I'm just thinking off the top of my head here. So I'm just wondering, can you maybe explain why the three MPs voted against it?
Well, we have a number of committees that deal with issues where we work with the United States. We have a trade committee, we have international affairs committee, we have environment committee. But we just had a president in the United States who ripped up NAFTA, who had tariffs on aluminum and steel, who was caging children who were coming across the border, who was, attacking allies and the order that had been established in World War II. And we never had a special committee then to deal with Donald Trump. That would be the president that we would want to be talking about. What is our relationship with the United States? This was a bellicose president, who abused our extradition treaty to have Meng Wanzhou arrested, and we end up with two Canadians, the two Michaels, who are arbitrarily detained by China. Donald Trump was causing us all kinds of problems in this country, and we didn't have a special committee to deal with him. What does the Biden administration think about us having a special committee to deal with the Biden administration when we didn't have a special committee to look at our relationship with Donald Trump? Like, what kind of a signal are we sending to the Biden administration? And so what is this committee about? Is it about Keystone XL? All of these parties that voted for this. I know the NDP supports the fracking pipeline, Coastal GasLink out west. We know that the Conservatives are upset about Keystone XL, which, all of our eggs are thrown into one basket because of our trade relationship and the way we've undermined our manufacturing base, including for pharmaceuticals in this country, so that we can export raw materials. And as soon as we can't get a pipeline to export raw bitumen out of this country, we have a national emergency and we need to examine our relationship with the United States. This is a president who wants to take action on climate change. Do these parties not want to take action on climate change? We have an environment committee. We have signed onto, agreements for climate agreements, 9 of them now, without any plans for any of them. And here's a president that wants to do something about it. We should just buckle down and do something about climate action in this country, because we are scofflaws. We are the worst of the G7 nations for greenhouse gas emissions. Our emissions have gone up more than 20%, where the UK have reduced theirs by 40%, and the rest of the European Union have been reducing their emissions. Only the United States and ourselves have increased emissions. In the United States, even under Donald Trump, it was 3% increase. So I just think this is a ridiculous idea, and it sends a very bad signal to President Biden. I'll let Annamie chime in though.
Well, just to close off before we go, guys, being very patient. This is always the thing, Guy, when if it's a press conference, you never know what questions might come up. In terms of our relationship with the United States, we are very excited to see that President Biden and his administration is committed to tackling the climate emergency, that they have a very ambitious plan for a green recovery. We're very excited about the opportunity that Canada has with the United States to create a North American strategy on the climate, whether that is a North American carbon border, or whether it is having a strategy to green our trade, our bilateral trade, or our trade within the context of our trade agreements. And so that is what we are focused on as a party. If we thought that this committee had that purpose in mind, strengthening that relationship and ensuring that it is as productive as possible in terms of protecting people in our country and in theirs, and helping us tackle the climate emergency, then it could be something that we could get behind. We do not think that it has that purpose, and for some of the reasons that Paul said and others. And so we think that we can completely consider our relationship with the United States within the context of our existing committees. And we're not really looking for any kind of grandstanding platform that will undermine what should be a really productive and fruitful relationship with the United States going forward.
Thank you, David. Thank you, Madame Paul. This will conclude the press conference. Thank you so much for attending. Merci à tout le monde. Ceci conclut la conférence de presse. Bonne journée.
Thank you very much, Guy. Thank you, Paul.